Heart blockage is one of the most dangerous health conditions because it often develops silently over many years before finally revealing itself through warning signs that many people dismiss as acidity, tiredness, stress, aging, or simple muscle pain, and unfortunately for some individuals, the first symptom becomes a sudden heart attack, which is why understanding the early warning signals of reduced blood flow to the heart can truly save lives, because your heart depends on a constant supply of oxygen-rich blood delivered through the coronary arteries, and when cholesterol deposits, inflammation, diabetes, smoking damage, high blood pressure, obesity, stress, lack of exercise, unhealthy diet, or genetic factors gradually narrow these arteries, the heart muscle begins struggling to receive enough oxygen during activity or even at rest, leading to symptoms that the body uses as distress signals asking for attention. And in this video we will discuss 5 critical warning signs of heart blockage that must never be ignored if you want to protect your heart health and reduce the risk of a future heart attack, beginning with the most common and important warning sign, which is chest discomfort or pressure, because many people imagine a heart problem always causes sudden severe stabbing pain, but in reality heart blockage more commonly produces heaviness, tightness, squeezing, burning, pressure, fullness, or a weight-like sensation in the center or left side of the chest, and this discomfort often appears during physical activity, climbing stairs, brisk walking, emotional stress, anger, or after heavy meals because these situations increase the heart's oxygen demand, while narrowed arteries cannot supply enough blood, causing a condition known as angina, and some patients describe it as someone sitting on their chest while others feel only mild tightness or pressure that disappears after rest, making them underestimate its seriousness, but recurrent chest discomfort, especially if triggered by exertion, should always be medically evaluated because it may indicate significant coronary artery disease. And the second major warning sign is shortness of breath or unusual breathlessness during routine activities, because when the heart struggles to pump efficiently due to reduced blood supply, fluid balance and oxygen delivery throughout the body become affected, making even normal physical activity feel exhausting. So if someone who previously climbed stairs comfortably suddenly becomes breathless while walking short distances, carrying groceries, speaking during activity, or performing simple daily tasks, this could indicate reduced heart function or underlying blockage. And many patients, especially women and elderly individuals, may experience breathlessness as the main symptom instead of chest pain, which is why unexplained shortness of breath should never be ignored, particularly when associated with fatigue, sweating, chest pressure, or dizziness. And speaking of fatigue, the third warning sign is persistent unusual tiredness or reduced stamina, because the heart is responsible for delivering oxygen and nutrients to every organ and muscle in the body. So when circulation becomes compromised, people may begin noticing exhaustion even after adequate sleep, lack of energy throughout the day, inability to perform regular activities, weakness during walking, reduced exercise tolerance, or overwhelming tiredness after minimal effort. And many individuals blame work stress, aging, or poor sleep while ignoring the possibility of heart disease. But if fatigue develops suddenly or progressively worsens without clear explanation, especially in patients with diabetes, high cholesterol, smoking history, obesity, or hypertension, then cardiovascular evaluation becomes important, because the heart may already be under stress from inadequate blood flow. And the fourth critical warning sign involves pain spreading beyond the chest, because heart-related pain frequently radiates to nearby regions including the left arm, both arms, shoulders, upper back, neck, jaw, teeth, or even the upper abdomen. And this referred pain occurs because nerves supplying the heart share pathways with other body areas, causing the brain to misinterpret the origin of discomfort, which is why some individuals, especially diabetics and women, may experience jaw pain, shoulder heaviness, back discomfort, or arm tingling without severe chest pain. And unfortunately such symptoms are often mistaken for cervical problems, acidity, muscular strain, dental issues, or gas, delaying life-saving treatment. So if pain or discomfort repeatedly appears with exertion, emotional stress, or physical activity and improves with rest, a cardiac cause should always be considered seriously. And the fifth major warning sign is dizziness, sweating, nausea, or fainting sensations, because inadequate blood supply to the heart can reduce effective circulation to the brain and other organs leading to lightheadedness, cold sweats, palpitations, nausea, or feeling as if one may collapse. And these symptoms become particularly concerning when occurring together with chest pressure, breathlessness, or exercise intolerance, since they may indicate unstable blood flow to the heart muscle or abnormal heart rhythms triggered by poor oxygen delivery. And many people, especially younger individuals, ignore these warning signals believing they are due to dehydration, anxiety, exhaustion, or low sugar levels, but recurring episodes require proper medical assessment because early diagnosis of heart blockage allows treatment before a catastrophic heart attack occurs. And it is important to understand that not every blocked artery causes identical symptoms because the severity depends on the degree of narrowing, the location of blockage, overall heart function, physical activity level, diabetes status, age, and whether collateral blood vessels have developed over time, which is why some people remain symptom-free until advanced disease while others develop early warning signs during moderate activity, and individuals at especially high risk include smokers, diabetics, patients with high blood pressure, high cholesterol, obesity, sedentary lifestyle, chronic stress, kidney disease, sleep apnea, strong family history of heart disease, or unhealthy dietary habits rich in processed foods, excessive salt, sugar, trans fats, and fried meals, because these factors accelerate inflammation and plaque buildup within the coronary arteries, and unfortunately modern lifestyle patterns involving long working hours, lack of sleep, physical inactivity, stress, late-night eating, excessive screen time, smoking, and poor dietary habits are increasing cardiovascular disease in younger age groups as well, which is why awareness and prevention have become more important than ever before, and many patients ask whether heart blockage symptoms can come and go, and the answer is yes, because stable angina often appears predictably during exertion and improves with rest, while unstable angina becomes more dangerous because symptoms may occur suddenly, more severely, more frequently, or even at rest. And unstable symptoms should always be treated as a medical emergency because they may indicate an impending heart attack. And another common misconception is believing that a normal ECG alone completely rules out heart disease, but in reality some patients require stress testing, echocardiography, CT angiography, coronary angiography, blood tests, or advanced cardiac evaluation depending on symptoms and risk profile, which is why self-diagnosis is risky and professional medical consultation remains essential. And prevention of heart blockage begins with lifestyle modifications including regular exercise, healthy weight management, avoiding tobacco, controlling diabetes and blood pressure, reducing stress, sleeping adequately, limiting processed foods, reducing excess salt and sugar intake, increasing fruits, vegetables, nuts, whole grains, healthy fats, and maintaining routine medical checkups because prevention is always safer and easier than treating advanced disease after complications occur. And exercise plays an important protective role because physical activity improves circulation, blood pressure, cholesterol profile, insulin sensitivity, and overall cardiovascular fitness, but individuals with warning symptoms during activity should seek medical evaluation before starting intense exercise programs because ignoring chest discomfort or breathlessness during exertion can be dangerous. And many patients also wonder whether young people can develop heart blockage, and unfortunately the answer is yes, especially in the presence of smoking, diabetes, obesity, severe stress, unhealthy diet, high cholesterol, genetic predisposition, steroid abuse, or sedentary lifestyle, which is why no age group should consider itself completely immune from heart disease. And another critical point is understanding silent heart disease, especially among diabetics, because diabetes can damage nerves, reducing pain sensation, causing severe heart blockage to develop with minimal or atypical symptoms such as fatigue, sweating, breathlessness, indigestion, or mild chest discomfort rather than classic severe chest pain, making regular screening extremely important in high-risk individuals. And if symptoms suddenly become severe, including crushing chest pain, breathlessness, cold sweating, vomiting, collapse, or pain radiating to the arm and jaw, emergency medical attention should never be delayed because early treatment during a heart attack can save heart muscle and significantly improve survival. And many lives are lost simply because patients wait too long hoping symptoms will disappear on their own. So listening to your body and recognizing early warning signs can truly make the difference between timely treatment and life-threatening complications. And finally, remember that heart blockage is often preventable and manageable when identified early, which is why awareness, regular health checkups, healthy lifestyle choices, stress management, exercise, balanced nutrition, and early medical consultation for suspicious symptoms are among the most powerful tools for protecting your heart health and ensuring a longer, healthier future for yourself and your loved ones.